During the COVID pandemic, a lot of people received unregulated amounts of steroids because steroids were the only medicines that were helpful during the COVID pandemic and were life-saving. But due to this, we have started seeing a known complication of steroids, which is called avascular necrosis. Avascular necrosis literally means that blood supply to a part of the bone is interrupted, due to which the bone cells have started dying, referred to as necrosis. Avascular necrosis is very common in the hip joints. It is also common in other joints of the body, but hip joints or the femoral head is one of the most common sites. Once AVN starts, the most common symptoms are pain in walking, pain in sitting on the floor, pain sitting cross-legged, stair climbing is painful, and eventually there is a lot of rest pain. So even when patients are sleeping, they start to have a lot of pain. Avascular necrosis of the hip has been managed historically pretty well with total hip replacements. Total hip replacements are great surgeries. They relieve you of all the pain, they give you great mobility, and they rapidly and progressively increase the quality of life. But post-COVID AVN is a problematic thing because these patients are very young. We have started receiving patients who are just 25 and they have AVN in both the hips and are living a very painful life. So post-COVID AVN, the first option is never a hip replacement. There are multiple other methods in which we try to prevent AVN from progressing or the femoral head from collapsing other than total hip replacement. It is very important for you to know that if you had COVID and you had received steroids and now you have started to have some pain in your hips, it is high time that you go and see an orthopedician. It can be AVN of the hips.